Hey, all, it's Dr. John, and you're all here to learn about NAD+. But let's get right to the point. This course is about adding what is, frankly, one of the easiest and most substantial revenue streams you can add to your practice. We're not talking about a 3-hour high commitment IV drip. We're talking about a simple 3-minute subcutaneous injection. This is the perfect add-on service. It greatly benefits your patients with things they're asking for: more energy, less brain fog, and real cellular level anti-aging. But here's the best part. The margins on SubQ NAD are so good that your best marketing strategy is just to give the first injection away for free. Think about that. You can offer a free single shot to your tox, IV, or GLP-1 client. You let them feel the difference. That one free shot, it hooks them. It gets them on the program. They will come back and add this to their appointments month after month after month. It's the easiest way to upsell that you'll ever have. So that's what this course is about. It's not just about science, it's about a simple 3-minute add on that benefits your patients, builds loyalty, and adds substantial recurring revenue to your bottom line. So let's get into the what and why of NAD. Now I'm going to give you a quick flashback back to your medical program. Remember the Krebs cycle, that nightmare of a chart? That's the engine in your mitochondria that creates all the energy, all that ATP for your entire body. Well, NAD plus is the spark plug that makes that engine turn over. If you don't have it, that engine doesn't start. You don't make energy, period. The engine is dead. So, if it's so great and it's in every cell, what's the problem? The problem is what I call the great cellular decline. When you're born, you are an energy making machine, just full of NAD+. But by the time you're 50, your natural levels have plummeted, maybe by 50% or more than when you were in your 20s. And what does that look like? It looks like aging. It looks like fatigue. It looks like that brain fog, that slower recovery, that cellular breakdown. This decline is the problem we are solving. So, how do we fix it? This brings us to the delivery methods. Your patients are going to ask, can I just take a pill? Have you heard that before? I have. Well, as most of you know, oral supplements are not a great option. Why? First pass metabolism. When you swallow that expensive pill, it goes to the liver, and the liver just breaks most of it down. It can sometimes be a waste of money. Then you have the IV drip. This is the gold standard for loading the body. It's 100% bioavailable. You can give a very high dose, and it's fantastic. But it's a 2 to 4 hour high ticket service. It's a big commitment for the patient and for your chair time. This brings us to the subcutaneous injection. This, for your practice, is the sweet spot. Think of it just like an insulin shot. It's fast, it's easy, and has a very high bioavailability. But the real key is that it provides a consistent steady state level of NAD plus in the body over a long period of time. This is the perfect low overhead, high impact add on to your existing services. So that's the what and the why. In the next module, let's dive into what this is for and what you can tell your patients to expect. All right. So in the last module, we covered the what and the why. You know, NAD plus is the spark plug. You know that subcutaneous injection is the sweet spot for your practice. Fast, easy, and highly effective. Now, what we're going to do is let's get into the clinical case. Who is this for? And what exactly are you going to tell your patients it does? When patients ask, what will I feel? I like to break it down in a few key categories. First, and this is the number one thing that people report, is energy and metabolism. We talked about that mitochondrial engine. Well, this is the high octane fuel for it. It's not just a jittery caffeine buzz. It's a clean cellular energy. It boosts stamina and it reduces that chronic fatigue. Second, cognitive function. This is the brain fog lifter. How many patients do you see who complain about brain fog? This is rampant. NAD plus is crucial for your neurons. Patients report enhanced mental clarity, better focus, and just feeling sharper. Third, the big one for our industry, anti-aging and DNA repair. This is the key aesthetic link. NAD plus is fuel for a specific group of genes called Sirtuins. Think of Sirtuins as the microscopic repair crew inside your cells. Their job is to run around and fix damaged DNA, but they're lazy. They can't work without fuel. No NAD plus, that repair crew is on a coffee break. We are giving them the fuel to get back to work. Fourth, recovery. This is the big one. Athletes, high performance executives, they burn through their NAD plus supply stores like none other. This also applies to patients recovering from a long illness, long haul symptoms, or even post surgical healing. NAD plus helps accelerate that recovery. So, who is the ideal NAD plus patient walking into your clinic for a shot? First, you've got your tired but healthy wellness client. This is the patient who eats right, they exercise, they're doing all the things, but they're just not feeling good. They're tired. These people are a perfect candidate. Second, you've got the biohacker or the anti aging enthusiast. This is an easy one. They've already listened to the podcast, they've read the blogs, they're just looking for a qualified, trusted provider, which is, guess what? You, to give it to them. Third, the high performance crowd. This is your athlete, your executive, your CEO. They aren't sick, they're looking for an edge. They want to optimize. This is a fantastic tool for them. Now, just as important as knowing who to treat is knowing who not to treat. This is where you are the medical professional. So let's talk about red lights. Okay, these are your firm absolutely nuts. Okay, number one red light, active cancer. This is a hard line in the sand, a firm no. We do not want risking fueling any metabolically active cancer cells. We just don't do it. Number two, pregnancy and breastfeeding. As always, there's no safety data here, so it's a non-starter. Grow the baby, feed the baby, and then we can work on ourselves again. So those are your two hard no's. All right. Now let's switch gears and go to the most important part of this module, managing expectations. This is where SubQ is different from the IV. You have to tell them this is a marathon, not a sprint. Okay, what do I mean by that? An IV drip is like a huge initial download. The SubQ shot is a consistency treatment. This is what you tell your patient. Hey, this is like a gym membership for your cells. One shot is great, and you might feel a boost, but the real benefit comes from consistent use, 2 or 3 times a week to build up and maintain those cellular levels. You, as the provider, are going to set that expectation and you are going to set them up for success. So that's your clinical case. Find the right patient, screen out the wrong ones, and set the tone for the expectation for consistency. All right, in the next module, we're going to get into the practical application, how to mix it, how to store it, and how to inject it safely. All right, so you've screened your patient, you know who's the right candidate, and you set the right expectation. Like this is a marathon, not a sprint. Now we need to get to that most important part of this course for you, the practical application. This is the how-to that makes this such an easy service to add. So pay attention because this is the protocol that gives you the confidence to start this tomorrow. So let's talk dosing and frequency. Remember, this is the steady state approach. We're not loading them like an IV. We're building up a consistent level in their cells. Your typical SubQ dose is going to be small. We're talking 50 milligrams to 100 milligrams tops. And the frequency, this is not a one and done shot. To get those steady state levels, you're going to be prescribing this for 2 to 3 times per week. Okay, so let's talk about injection technique. This is the easiest part for all of you. It's fast, easy subcutaneous injection. This is not intramuscular. Do not put this in the muscle. You're going to use a tiny insulin needle, just like you would for a GLP-1 shot. A 29, 30, or 31 gauge is perfect. 6 to 8 millimeters, somewhere in there, so we can get through the skin into the subQ tissue. Where do you inject? Same places. Abdomen is a great place, at least 2 inches away from the navel. You can do it in the thigh, any area with a good amount of subcutaneous fat. Back of the arm's another good spot. Finally, let's talk about side effects. This is the best part about SubQ and the key difference from the IV. Remember that intense NAD plus response that we see to get from the IV drip? That chest tightness, the anxiety, the nausea, that feeling of impending doom? With a SubQ shot, it's gone. You will not get that intense systemic response because the absorption is so slow and controlled. This makes it 1,000 times easier for you and the patient to tolerate. So what is the main side effect? It's simple. Local injection site reaction. What does it feel like? The patient's going to tell you it's red, it's itchy, or there's a small welt at the injection site. It'll look like kind of like a mosquito bite. All right. You must handle this with education before you inject, however. Prep them for them. Say, all right, after this shot, it's completely normal to get a little red, itchy, and at this spot that we injected right here. NAD is a natural acidic, so it's a bit irritating to the tissue. It's not an allergy, it's just a normal response, and it will go away in an hour or two. So just set that expectation. And if you've done that, you've handled the side effect before it even happens. Let's go back to dosing and frequency and some different protocols you can do. All right. Uh, I like the protocol where we have two phases. I call it the initiation phase and the maintenance phase. Okay, what do I mean by that? When you're getting people going on NAD plus, it takes a little bit more at the beginning than at the end. So we kind of load them up. We don't want to overwhelm them. We don't want to get any of those side effects from too much NAD that you see with like IV therapy. What kind of side effects do we see with IV therapy? Headaches, hot flashes, cardiac arrhythmias, nausea, stuff like that. And if you go really high dose right at the beginning, you're going to get a lot of those side effects. So instead, work your way up to a dose like 100 milligrams. All right. So start them off with biweekly injections. That's two injections a week at 25 milligrams or 30 milligrams, somewhere in there. Do that for a week or two. All right. Then up it, then double it and go from 25 to 50. All right. Do that for a week or two. Then go from that 50 to 100 and do that for a week or two. And then that's their dose, right? Twice a week and 100 milligrams. Okay. If you, I tell them, hey, inject yourself Mondays and Wednesdays, or Mondays and Thursdays. And what does that do? Monday will get them through their work week. They hit midweek again, and then gets them through the last of the week, and then take the weekends off. Okay. I love that protocol. Some people even want it during the weekend, then you can maybe do it 3 times a week, like every other day throughout the week. But weeks have odd numbers. I like the Monday, Wednesday approach personally for my clients. All right, so that's the loading dose. That's the initiation phase. You're going to do that for about 2 months. Okay, you're going to get them to that 100 milligrams. Once you get them up there, we don't want to keep them there because what will happen is your body's going to get used to not having to worry about NAD. And it's going to stop producing its own NAD because you got plenty of it. It's going to say, hey, I've got plenty of this NAD. Let's produce something else. Let's work on something else. We don't want that to happen. You don't want to completely replace their native NAD that they have. You want to supplement a diminished amount of NAD. Okay, so then once we got that loading dose after a couple months, what are we going to do? We're going to take it down. We're going to take it down to either weekly, biweekly, or monthly injections. And for those, I like the 100 milligram dose, somewhere around there. Keep it about 100 milligrams, weekly, see how we're doing with that. And then the last thing I like to do is I like to be 3 months on, 1 month off. All right, so 3 months on, 1 month off. What does that do? It lets it clear your system. It lets the patient recover their natural NAD. It doesn't make them dependent on this substance, and then you start the process over again. Okay, so and then once you take that 1 month off, do you have to go back to the starting dose? Modified. Say, okay, you got the 1 month off. Now let's do 50 milligrams biweekly. See if they tolerate that. For a couple weeks, and then get them right back to 100 milligrams weekly. All right, that's the protocol I like to use in my practice, and we'll attach that protocol here in your course materials. So now that you know how to do it safely, let's talk about how you're going to make money doing it. All right, you've got the science, you know how to treat, and you have the protocol to do it safely. You know how to reconstitute, refrigerate, and inject this product. Now let's talk about the business, because we're not just going to be doing this for fun. We're doing this to build a practice. And the SubQ NAD plus shot is probably one of the easiest, highest profit services you can add. This is all about the easy add-on revenue model. So I want you to think about it. Think about that IV drip. That's a whole different business. That's a 3-hour high ticket service that takes up your chair and your time. Frankly, it's a commitment. This is a 3-minute high profit add-on. What do I mean by that? It's the perfect service to add to any other appointment. Your patient's already there for their Botox, their filler, their IV drip. You've already got them. You're just ending that appointment by saying something like, hey, while you're here, let me talk to you about my client's favorite add-on, NAD+. And this is the easy upsell you're ever going to have. Now, there are 2 main ways you can sell this. First, in office. This is simple. You can sell single shots or better yet, package of shots. The patient comes in 2 to 3 times a week for a quick 5-minute injector only nurse appointment. It's fast, it's easy, and it gets them in your practice building that relationship and that trust between you and them. Second, and this is a great model if your state laws and protocols allow for it, is the take-home package. You sell them a monthly supply. They buy a package of, let's say, 12 shots, and they self-administer at home. This is fantastic for your patient's compliance, and your cash flow. All right, so let's take a little digression. When can you give the patient medication or have medication for self administration at home? All right, this is where we go back to both state laws and the 503A and 503B pharmacies that you're going to acquire this product for. Okay. If you're going to have the patient take this at home, it is better that you work with the pharmacy to deliver that straight to the patient's house. If you do that, you're not acting as a pharmacist, you're not acting as a dispenser. The pharmacy took your order that your medical director gave you, or if you are a medical director, that you put in, and they're going to process that order and ship it to your patient's house. If you do that, it will be shipped with needles and alcohol swabs and everything that they need that they can store in their refrigerator. All right. That's the best way to do it. Now, you might want to do the first few injections in your office to teach them how to inject. Okay. First one, you go through the process and you show them how to inject, telling them to move the sites around the belly or the back of the arm, or go from one arm to the other, something along those lines. You tell them how to dose it appropriately, and you teach them how to do that. So the first visit, you're injecting. The second visit, you let them inject. Have them draw up the medication. Okay. Now you can keep this at your office, or they can bring it in with them. Okay. And then the third visit, if you want a third one, they do it all on themselves. Okay. So that's how you would do it if you want them to go home with it. All right. Now, in states that allow it, you can order a 503B medication that is for your practice only. This allows you to self-administer patients as they come in. Okay, that does not allow you to give that medication to the patient to go home with. All right. You can also order a 503A pharmacy that is patient specific, that is delivered to your practice if your states allow it. Now, there's a lot of states that do not allow this. There's about half the states out there that allow you to do that. Have a med shipped to your practice, and then you administer to the patient. Okay. In no circumstance are you getting a medication from the pharmacy that is specific to your practice that you then give to your patient. Now you just become a pharmacy. Okay. The minute you give a medication that has not been prescribed directly from your patient from a pharmacy, you're now the pharmacist. And in almost all the states, you're not allowed to do that. Okay, so best case scenario, have it shipped directly to your patient's house. Second best case scenario, have it shipped to a patient specific, shipped to your practice for you to help them administer. They can then go home with that because it's under their name. Third best, 503B, it comes to your practice and then you inject, but they can never go home with that medication. So I hope that clears that up a little bit. So now let's talk pricing. This is completely different from the IV pricing model. The IV is a high price, low frequency service. The SubQ shot is a low price, high frequency service. You are going to price this as an easy yes. It's not a huge, scary, investment or commitment. Remember, this is an add-on. The profit here doesn't come from one big sell. It comes from volume and consistency. You make your money by selling a package of 12 shots for the month, not just one. Okay. Finally, a quick heads up on marketing. How do we talk about this to our population? The FDA is cracking down on claims. You have to be smart. You do not say, this will reverse aging. You do not say, this cures a disease. If you do that, you're going to get in trouble, right? Because it's unfounded. So what do you say? This is what you do say. This supports cellular repair. It's true. This boosts mitochondrial energy, 100%. This enhances mental clarity. You can also say something like, this promotes a whole body wellness. You are supporting the body, not curing a disease. It's that simple. So that's the business case. It's a simple, low cost, high frequency add-on that builds incredible loyalty. All right, in the final module, let's wrap it all up and get you ready to seize the day. All right, so that's the course. Now let's diverge a little bit and let's make a business case for it. Like, what should you be charging? What does the profit margins look like on this stuff? So, if you're a 5 Square member, we have negotiated some contracts with you with some nationwide pharmacies, and I just pulled some of that pricing data as of today, as of the filming of this course. We typically can get that to you for about 8 cents a milligram. All right. You're gonna have some shipping costs and stuff like that in there as well, but let's just round it up to 10 cents a milligram for easy math. What do I charge for it? Anywhere from 50 cents a milligram to $1 a milligram. Now, if they're coming into my office for an IV infusion, I'm charging them $1 a milligram. Okay, that's going to be a high dose, probably 300, 200 to 300 milligram dose over a 3 to 4 hour period. It's going to be a lot of work, so I'm going to charge them, $500 for that if they're coming into my office for IV. So that's over $1 a milligram. Okay. But if I'm doing subcutaneous injections that either they come in for me or they can do at home, I can get by with 50 cents a milligram or maybe $1 a milligram. All right. So what does that math equal out? Um, if if they're going to use 1,000 milligrams over the course of the month, it's going to cost me roughly $100 to get that to them. Charge them $500 on top of that, and they're going to keep coming back for more. You just made $400 of profit off an injection they're doing at their house. That's at 50 cents a milligram. Okay. If you're in a market where the price is higher, go up, charge $1,000 or a dollar a milligram, sell it for $1,000 a month. Now, $1,000 a month is going to push people out, right? You're going to have a lot of people that say, I feel good, but Jesus, $1,000 a month, right? So that $500 barrier is kind of a mental thing for a lot of people. So price it at $475 a month, $499 a month, something like that. Get it below the $500 barrier. They're going to feel great. And if they have a little bit of disposable income, you can bet your bottom dollar they're going to do it. So that's a business case for you. Now, $500 a month sounds like a lot, but maybe you can bundle this with something else. Maybe they're on a GLP-1 program with you and they're paying $300 a month. Maybe drop it, say, hey, you have a bundle, let's drop it to 25 cents a milligram. Remember, you bought it for $1, you're going to get 2.5 on it. That's 75% margins. And bundle it with your GLP-1s. Hey, for another $200 a month, I'll get you a weekly injection of an NAD plus, right? Or hey, for an extra, $399 a month, I'll get you bi-weekly injections, okay, of the medication. So, anyways, you get my drift. This is a great thing to bundle. Okay, we always say bundle your most expensive service with your most profitable service. Okay, and what do? You discount the most profitable service because you have a lot of margins in there to get them into the bigger service. So what do I mean by that? Let's say your most expensive treatment in your option is a GLP-1 membership at, $499 a month. Okay. What do? You take your most profitable thing, NAD plus, high margins, and you bundle it with that. And then what did you do? You just made that bundle look more valuable to them, and you're making more money off that. And that has worked really well for me in my practice. It could be, you could bundle it with tox, hey, $25 subcutaneous injections with any tox treatment for the month of December. That's an option. Okay. What do those injections cost you? Well, 50 milligram injection. It's going to cost you $5. You're going to charge 25. You just made $20 just by adding it on. Right. So you get my drift. So we just went through a math case for you, and you're like, holy smokes, this is a lot of margins. And I see this all the time with healthcare providers. We are very empathetic individuals. We care about our patients. We're almost stewards of their finances. We tend to empathize with their financial situations. And as a result, we tend to diminish our value to them. And I strongly encourage you not to do that. And here's why. Yes, there's great margins in this product, but it still takes time to educate. It still takes time to administer. It still takes time to order supplies and all of that kind of stuff. And your time is money. And in this industry, I want you making at least $500 an hour doing these type of treatments. So your time is what you are selling, not so much the product. It's mostly your time. All right. Do not undervalue yourself. You are worth what you're worth. You went and you got a degree. You went and you got all the specialized training. You went and you started a business. You went and rented a space. You did all this stuff to bring this treatment to your patients. Do not have the poverty mentality. What's poverty mentality? Poverty mentality is, man, I really value my dollars. That means everybody must value their dollars the same way I value them. Or, man, nobody can afford this stuff. I better price it right. Okay. Do not go down that mindset. It's really, really hard to run a business when you have a poverty mentality. Price your services for what they're worth. If they want to do it, great. If not, that's fine too. Right? But don't devalue yourself. Don't race to the bottom. When you race to the bottom, meaning, hey, I call all these clinics around town. I found out, hey, there's this one clinic on the other side of town that's charging, 25 cents a milligram. I was charging 50 cents. Maybe I should raise and match them so I can be competitive. Do not do that. Here's what's going to happen. You are going to attract the couponers, the Grouponers. They're going to come in, they're going to see a good deal, they're going to partake, and then they're going to leave. How do I know this? Because I've done it. I've done it many, many times. You want to price yourself at the higher end of the market and get those people that come and love you and they don't care how much it costs. Okay? Yes, you're going to have less volume, but you're going to have a higher quality client. They're not going to be as complaining. They're not going to be as bitchy about it. Those low value clients are the ones that complain. They'll leave you the 1-star Google review because they got an irritation at the injection site and they didn't get it at the last place. You know what I mean? So value yourself accordingly, price yourself accordingly, and your price is your price. Hope you learned a few things, and now take it and run with it.